cranky.
Yeah, I'm gonna talk, and all of a sudden I'm gonna start choking.
Slow it down if you need to. I have chest pain watching you do it that fast.
Yeah, I can feel it. All right.
Take a breath. All good.
So what's up, guys? I'm here today with Nurse Christina as I'm going through my NAD treatment. So excuse me as this kind of passes through my body, but I want to get Christina here today to talk a little bit about NAD, given her expertise and also her side of it while she went through NAD treatment. So I guess tell us a little bit about NAD and what it actually does to the body on a cellular level.
Okay. So, hey everybody, my name is Christina. I'm one of the nurses here at Dr. Bargis's office. So NAD is basically a B3 vitamin. So it's niacinamide adenine dinucleotide. So NAD, which is basically a naturally occurring substance in the body. So when we're born, our NAD levels are at an all-time high up until we're about 20 years old. Between the ages of 20 and 40, they start to decrease, which is part of why we, become fatigued. Our energy goes down. This is part of the aging process when our NAD levels are lower. So the benefits of NAD intravenously is that you bypass the gut completely, so you get 100% absorption of what you're getting. It is recommended to do roughly between 5 sessions or 5 treatments within a 10 to 14 day or 10 treatments over a 21 day time period. Some of the things that NAD is beneficial for, it's great. It's an anti-aging. Most definitely.
How does that work? You mentioned something with the DNA strand.
So basically what it does is it helps restore and repair your DNA.
Okay.
And one of the studies that are out there showing that it elongates like your telomeres, which is part of your DNA. So over time they shrink, which is again just an aging process. This helps to elongate them. Basically, NAD helps overall cellular function. Gotcha. So the cellular metabolism, the ATP production in every one of our cells. Without ATP, which is what produces energy in our body, we're dead without it, ideally. So this helps just kind of restore that function in every cell, literally in your body. So brain, body, the whole 9 yards. The anti-aging aspect, just because of how it repairs the DNA over time.
They say NAD is the communication molecule within the cell.
Correct.
So I guess the more communication we have inside us, the more we're able to communicate in.
Exactly. Think of it like this is just kind of a weird analogy, but think about, any relationship, when there's between humans, when there's a lack of connection, that relationship falls apart. So think about increasing the synapses and increasing the way that our brain talks to our body and our body talks to our brain. We're all interconnected. Our cells are everywhere. So when you increase that communication, you're effectively increasing how everything functions, mentally, emotionally, physically.
Yeah. So yesterday, one of the experience that I had after having my PTSD between traumas that happened in my life was my lack of connection with people. And slowly it's been coming back. But yesterday, one of the things, I've had a few different experiences. One of them I was telling you about was my sense of smell was heightened, my sense of taste was heightened, but also my ability to communicate and actually feel like I wasn't forcing communication. Like I was able to have conversations and listen and communicate back and forth. And today, driving here, I was listening to a podcast, and usually I listen to a podcast about sometimes when things go into one ear and out the other. Yeah. That's kind of like how I was for a while. And today I felt like I was able to actually absorb more information. Yeah. Do you believe that the NAD could be the cause of that, being that everything's communicating?
Definitely. Well, think about it. A lot of that is can be emotional stuff, which is all ideally powered by our brain. And this is working to, again, think of a bridge, that's getting repaired. You're just basically helping to restore, energy and flow to that area. So when you're connecting all those pieces, we're all, we're emotional, we're mental, we're physical, we're spiritual, we're all of those things interconnected. So here is our most powerful part of our body. Here affects everywhere else. So when you're fixing and repairing, cells and damage and stuff like that to your cells in your brain, of course it's going to affect you positively in almost every other area of your life.
Yeah. So who would you recommend NAD to? Like what kind of symptoms or, I guess, potential patients?
Yeah. Really anyone. There's, again, no one's going to have an allergic reaction to NAD. It's something that's already found in your body. So as far as the patients that we're treating, anxiety, depression, PTSD, chronic fatigue, OCD, ADD, ADHD, cancer patients, autoimmune, athletes, a ton of athletes that are just looking for more, performance enhancement and just more energy and, being able to go that extra mile and just have that little extra, oomph when they're doing their trainings and stuff like that. So there's really no one that wouldn't benefit from it.
Gotcha. So is there any side effects to NAD after?
No, just feeling better and living a better life.
Good?
There's really can just say, so when I did my treatments, I did 6 total so far. I did my 5 and now I do it once a month, which is recommended just for maintenance for everybody. I will say at first I didn't notice a whole lot of a difference, but I wasn't focusing too much on it. I was just like, and then I realized after like the third and fourth session where I was sleeping much better, hands down. I woke up a lot, had a hard time falling back asleep just because of just brain, thoughts and just, worrying and stress and just, being able to turn that off to focus on just getting sleep made it a little bit challenging. So I will say I was definitely able to go to sleep and have a good night's sleep. I wasn't, my stress level just went down so substantially. But nothing else changed in my life. So all the same stressors were there, family, work, the whole 9 yards. Everything was still there. The outside factors and influences that stressed me out were still there. I was the one that changed in how I'm perceiving stress, how I'm processing stress, and how I'm handling it. So like I said to you yesterday, the best way I could describe my experience is I just think of my brain was like that really messy desk. I knew where everything was. It was organized chaos.
Yeah.
But the stress was, don't forget to do this, don't forget to do that, and even my OCD. I have a lot of OCD patterns that I was doing before I left the house in the morning, just like rituals almost of checking things and all that I noticed after the 4th treatment I wasn't doing.
Yeah.
And I was leaving my house without checking things, and I was like, oh my God. But I wasn't stressed, but it's okay.
It was more of being aware of the habitual pattern.
Exactly. Where I walked, I had such a routine of walking out of my house doing a certain thing, and I walked out a different way. And then I was like, wait, I didn't go around the counter this way, or, just something weird like that.
You realize it's okay.
Exactly.
Right?
And where I wasn't okay.
Do you think also, because I realize OCD and then just being our focus and stuff, and when you're not focused yet, things that you feel are important around you, feel like you always have to check on. So I feel like maybe OCD is also created because our brain is a little scattered. So we do our rituals of making sure our wallet, keys, all this stuff, as opposed to just feeling confident that we have it because we're focused and we're
So I would focus on, the reason that I had my ritual of my OCD was a fear, which is emotional.
Yeah.
So it was fear of, if I don't check the burners, the house is going to burn down or something that, but that's, realistically not really going to happen.
It's an illusion.
That's my fear.
That,
exactly.
Yeah.
I created that fear in my own mind. How and where, I have no idea where it came from. There was no traumatic event or anything. But that had been such a pattern for, at least 20 years, minimum.
Yeah.
20 years, probably longer.
So do you believe that this helps you overcome fear more because you're less stressed, you're more focused, and it's you start to realize what's reality and what's the illusion?
Well, and that again, my brain created that fear.
Yeah.
Which is a false belief.
Yeah.
That my mind created. So I'm not stressed or worried that if I don't check these things, bad things are going to happen.
Mm-hmm.
You know what I mean?
Yeah. Which is a flight or fight response.
Exactly. So, and then I would say, like, for the, like, organizational aspect. So, like I said, I have a lot on my plate. I have a lot going on in my life. I have a very busy, you know, job and lifestyle and business outside of this. And I was constantly stressed out, which led to the lack of sleep and just the worry. So now I feel like I'm just on top of my game.
Yeah, which
like
allows you to sleep
everything,
at night,
right? So everything that was on that desk is still there.
Mm-hmm.
It's just filed, and I know where it is. So I'm not worried I'm going to forget anything, or a piece of paper is going to fall off the desk and be like, "Oh my God, I didn't do that." I'm actually just much more efficient than I was before. And now that I don't have the stress of forgetting something, I'm able to focus on more positive things that allow me to thrive even more.
Yeah.
Because I'm not energy depleted by worry and stress. Where now I'm like, okay, I'm good. What next can I do? What more can I do?
Yeah.
So I'm actually able to just function and do more.
Do you feel, I guess, diet-wise, do you feel more conscious of your diet being now that you have this energy and kind of want to maintain it?
Definitely. Energy-wise, like I said, unprecedented. I mean, my family sees the difference, and I just see it like with my kids, just my ability to... I'm just more outgoing now. Mm-hmm. I had a lot of anxiety before, social anxiety.
Mm-hmm. How was that?
Being out in like public, you know, when it was speaking in front of people was an issue for me, believe it or not. A huge issue. And I don't want to say I don't care. It's just not a fear.
Yeah.
Like now I can get in front of a room of people and talk about something that I'm passionate about.
Yeah.
And I don't have that anxiety. And now I'm more outgoing where I'm like, okay, let's go do this and let's go do this and let's go to the park and let's do this. And I didn't have that energy before.
Yeah.
To be able to do that stuff with my kids.
Yeah. So all that energy allows you to push yourself, and then you become more sure of yourself because you're actually doing it.
Right. Well, it has that, you know, that trickle down effect. You know, now I'm doing more and I feel good, and my kids are happier. I'm happier. You know, holistically, you know, whole picture wise, everything is just better.
Awesome.
Yeah. So I'm stoked.
Great.
It's been a blessing.
Yeah.
Without a doubt.
Where do you think this treatment, like, I mean, I've just heard about it. It's kind of becoming more popular now.
Yeah.
But where do you see this kind of treatment going in the next few years?
You know, in a perfect world, I'd love to see this mainstream, obviously.
It's a little expensive to get this kind of treatment.
Right. But the benefits are just unprecedented.
Yeah.
You know, and it's not targeted to just one, you know, gender, or just one this or the other, or just one, you know, disease or issue, however you want to look at it. It really is for everybody. So in a perfect world, I would love to see this available for everyone. Not that it's not, but definitely, and especially for addiction. I mean, it has incredible, you know, I don't know if you've done the research, but incredible results for addiction.
Yeah, I've seen testimonials and stuff. A lot of, like heroin's like the hardest thing to kick off, and like within a few days, people were able to get off it without withdrawals. And
they're not withdrawing the way that they are. So most people that go, you know, and this is just, you know, out there statistics, is that most people that go to like a rehab or a 30-day program and stuff like that, success rate wise is usually like 30 or 40%, which isn't awesome. You know, I mean, it's great for that 30 or 40%, but you're talking about, you know, 60, 70% that are going to have a relapse.
And even the success, I heard, is not still 100%.
Exactly.
Like they're a
remember,
better.
Huge emotional component when it comes to addiction too. So if you're not fixing both, you know, and that's where this is kind of like plays in everywhere.
Because it pulls out the emotions.
Exactly.
I heard emotions are stored in the muscle, but you're also talking about cells. I mean, you have cells in the muscles, so when you clear out those energy blocks, those emotions.
Exactly. Well, it's energy, it's vibration and frequency, like we were talking about yesterday, you know. That's how we all resonate.
Yeah.
You know, so whether it's emotional, physical, spiritual, whatever it may be.
So I was listening to Dr. Lipton on the way here, and he's big into spirituality and how it connects with